I'm AZIZZA Davis Goines. I'm the president and CEO for the Sacramento Black Chamber of Commerce. And we are once again really delighted to be here with the Congressional Black Caucus Foundation's annual legislative conference. This is probably the 10th or 11th year that we've participated in this event because we believe very deeply in trying very hard to build sustainability in our underrepresented communities. We work as a collaborative here in the Sacramento area of California to do just that. Today, you're going to hear from some experts in the fields that they work to talk about and hear them talk about how they are doing the same thing and working to build that sustainability. This year, we know that in all the years that we've been doing this work, that without equity, sustainability cannot exist. And so we will be looking at that issue today and talking about that. We have to have all of those pieces in place to make our goal successful in building that sustainability. I'm going to turn this over in just a second to our moderator after I introduce him, and then he will take it from there, and I will see you again at the end of the show. But before I do that, I really want to thank our supporters and our sponsors, SMUD, which is the Sacramento Municipal Utility District, and also Southern California Edison, another utility district here in California. We couldn't do this without your support. Thank you so much for all that you do and all that you give to not only the Sacramento Black Chamber of Commerce, but also to the districts in which you serve so well.
Did you know that Sacramento is among the top 10 most polluted cities in the nation? And while California has some of the most aggressive carbon reduction goals in the world, there's much more to be done. SMUD has a bold new clean energy vision to eliminate carbon emissions in our power supply by 2030, the most ambitious goal of any large utility in the United States. At the same time, we're committed to continuing to provide safe and reliable power, with rates among the lowest in the state. We are your community-owned, not-for-profit electric company that's been serving in the best interest of our customers and community for over 70 years. Because of you, we're striving for a zero-carbon future that will lead to a cleaner and healthier region for all, today and for future generations. Visit smud.org/zero-carbon to see how you can be a part of the solution.
Larry Lee, in full disclosure, is not only excellent at what he does, he's also a very good friend of mine. And I'm delighted to have him here with us again today. He is leading the Observer Media Group into the 21st century as a powerful multimedia voice for the ethnic consumer. Larry, who has a lifelong career in ethnic media and marketing, inherited an admirable sense of quality, community, commendable work ethic, and dedication, excellence from his parents, Dr. William H. Lee and Catherine C. Lee, the owners and publishers of the award-winning Observer newspapers. Larry has taken that bold, creative legacy and applied it to a number of exciting products that influence, inform, and impact the African-American audience he serves. Larry, I'm so delighted to have you with us again today. Thank you so much for giving of your time. I know what your schedule's like, but we're really happy to have you with us.
AZIZZA, thank you so much for that introduction. And it is my pleasure and privilege to be joining the Sacramento Black Chamber of Commerce and the California Legislative Black Caucus with this panel. And in full disclosure, yes, AZIZZA is an absolute wonderful friend, and I am a former board chair of the Sacramento Black Chamber of Commerce as well too. So I know very well about the work that the Sacramento Black Chamber of Commerce is doing, as well as the work of the sponsors such as SMUD and Southern California Edison are doing as well to support that work. So I want to just take a moment to thank them as well to support you in that, and look forward to having a wonderful discussion with this great panel and really trying to address where some areas that that need some addressing. So thank you so much for your dedication and your work to the Chamber and to the community of Sacramento, as well as AZIZZA. So with that, we'll get this virtual session going. Again, I'm Larry Lee, and I want to take a brief moment to just introduce very briefly our panelists. We have Leonard Robinson, who is joining us. Leonard, give everyone a wave. Thumbs up is great. Lewis Stewart, go ahead and give everyone a wave as well too. Dr. Mario San Bartolome, Dr. Mario, there you go. And Torrence Powell. There we go, great. So everyone's video's working, so we know we're all in the right place. So what I'd like to do, instead of just kind of reading bios, I'd like to just kind of throw out a very simple question, because as AZIZZA mentioned, this panel discussion is very important because what we really want to do is address sustainabilities in the communities that we serve. Many of us are very specifically targeting communities of color and those that have been historically underrepresented. But we want to really address the need for structural and social change in areas like healthcare, economic development, education, housing, and energy to really address how sustainability can be built and how that can be done with a lens of equity. And please note that I use the word equity and not necessarily equality. And I think Leonard Robinson will help speak to some of that as we go forward throughout this panel. But as our African-American communities and other communities of color have been historically underrepresented in these areas, how can cities, states, governments, agencies, how can they fight on behalf of those communities that have been underrepresented to really make sure that as organizations and programs are moved forward with their own sustainability efforts, how can we make sure that equity is a part of that conversation? So with that said, really I'll just start it with a very simple question. What does equity and sustainability mean from your perspective? I'll just go with the first box that is on my screen, which is Leonard Robinson. So Leonard, if you can just give us try not to be too long. Tell us a little bit about yourself. Tell us a little bit from your perspective, if you can, about answering that question. We'll move it on through the rest of the panelists.
Excellent, excellent. Well, thank you, Larry. Thank you, AZIZZA, for having me again. And, my name's Leonard Robinson, and I used to work with the state of Sacramento and the Schwarzenegger administration at the California Environmental Protection Agency. Plus, I got engaged with a lot of groups. I had a radio show, and I've been in the environmental sustainability field about 45 years. Don't let this gray beard fool you. And I really enjoy it. And first, I want to say, when I first came to Sacramento, I came with guns blazing about environmental sustainability, and I called every community group. And the only three people that didn't hang up on me was the late Aubrey Stone, Larry Lee and his father, Dr. Lee, and AZIZZA. They actually listened, or at least they didn't hang up on me in the first time around, so I appreciate that. Equity in the community. That means, equality means everybody starts out at the same time. Equity means everybody ends up at the same place. Equality assumes everybody gets the same amount of things and at the same time. Equity means you've looked at each individual in each community's case and said, what do you need to succeed? And we need that in the community because sustainability is people, planet, prosperity. You have to have all three.
Wow. Leonard, you said them out. Say that last part again. Sustainability
consists of people, planet, prosperity. You have to have all three in various amounts, whatever the needs are of the community.
Love that. That's a great way to summarize that. Okay, thanks so much. And I am Leonard. I will applaud you for being brief. That is a for you, I know that is a brief introduction, so I thank you, sir, for that. Lewis, let's go to you. What is
So yeah, Larry,
you got to
thanks
follow
for,
Leonard.
I know that's hard. So Lewis Stewart, Head of Strategic Initiatives for NVIDIA developer ecosystem. I want to thank AZIZZA for having me back again. And, you know, for following Leonard is tough, but what he said is 100% spot on. In my former role as a Chief Innovation Officer for the City of Sacramento was really focused on people and prosperity. The planet was something that we incorporated. So from an economic development side of the world, it really was, how do we bring sustainability to underrepresented communities when it came to innovation? And how do we make sure that as innovation came to life, underrepresented, historically marginalized communities knew about the opportunities and were able to participate in those opportunities? And a lot of that came in the form of trying to work with folks like TORENCE over at the community colleges, or working with Leonard on the environmental front to make sure that, you know, whether it be autonomous cars to economic development programs like economic gardening, impacted the community the way it was supposed to, or we brought together folks that offer training to Black and Brown folks in the community to let them know what was coming and make sure they had the skills to participate. Now on this side with NVIDIA, it's really about using a company lens to impact the same thing. So happy to be part of this panel.
Great, thank you so much for your introduction. Dr. Mario, if I can come to you, what does equity and sustainability look like from your perspective in healthcare?
Well, thank you once again as well for extending the invitation to me and to Molina Healthcare. I'd say that in the realm of healthcare, sustainability, it's something that's really woven into the DNA of how we now view healthcare from a whole person type of perspective. In my training, and I'm come from a clinical background of being triple boarded in family medicine, addiction medicine, and preventive medicine. So when I think of things, the lens that I view a lot of these issues around sustainability, they really come to light in the kind of the brown and Black communities in particular, because we happen to be overrepresented in some disease states. And we all know and can probably appreciate that no matter how much money you have and how much anything else that you have, actually, if you don't have health, then everything else really goes away, including economic opportunity, ability to sustain your family, and all these other things. Molina was started off actually by a doctor in the southern part of Los Angeles County in Long Beach, where I trained, Dr. Molina, who worked in the emergency room and figured out, why is it that some folks are getting all of their healthcare in an emergency room? Why aren't they, where's the community of healthcare providers that are seeing these people in an outpatient setting and preventing things rather than doing crisis care all the time? And why does it happen to be certain groups? And so he left that and he started his own clinic. And from there came about this concept of a health plan. And so the perspective from the health plan really is that overall social determinant of health is actually been thought of as really representing upwards of about 80% of the health outcome. So as fancy as I could be here, talk to you about receptor physiology and medications and geeking out on you all day long, at the end of the day, it might be that Miss Jones didn't have a ride to her prenatal visit. And that was the reason why there's a difference between infant mortality from one side of the tracks versus another side of the tracks. So it's very important that when we look at this concept of in our world, right, health equity, it incorporates areas around health literacy, around opportunities and access from the standpoint of transportation, from the aspects around safety in a community, because safety in and of itself is a social determinant of health. If you don't feel safe enough to go outside your doors because of violence that's happening in your neighborhood, that might be one of the reasons why you might have increases in social isolation. And social isolation, as we see in COVID-19 during this era, there's been a huge disproportional effect in communities of color from the standpoint of major depressive disorder, anxiety disorders, and substance use issues. And if we look at, again, my lens from the standpoint of as an addiction medicine doctor, we've had a 93,000 deaths in 2020 from overdoses related to substances. And if we look at the track record of populations, like say the Black population, going back to 2000 to where we're at now, there's been a 7-fold increase in deaths in that one group. And we just have to scratch our heads and say, well, what's going on? It's very similar in the Latinx community. So for a health plan, it has all to do with everything that we offer outside of medicines, outside of individual doctor care, that really is that ecosystem around what determines somebody's real health. And it's not necessarily with the medicine. So from our end, it's investment in the communities, particularly around those community-based organizations.
That's well said, and you dropped some really important information there for our audience. So thank you so much, Dr. Mario. Last but certainly not least, Dr. Torrence Powell. Welcome to the conversation, and I'd like to ask you as well. You're in the education space. What does equity and sustainability look like for you from your perspective?
Thank you, Larry. I'd say that equity is really at the central foundation of what we do in the California Community College system specifically. In my current role, I serve as the Associate Vice Chancellor of Instruction, Workforce and Economic Development. And in that role, I oversee essentially the entire instructional wing for our 4 colleges in the Sacramento region. And Sacramento is the second largest, or Los Rios rather, is the second largest community college district in the state. And so we serve a very large number of students, the majority of which are students of color, first generation students, students from low socioeconomic status backgrounds, students who otherwise may not have the opportunity to even pursue higher education in the absence of our institution. And so equity is really the central foundational piece based solely upon, or primarily upon, the population of students that we serve. And I think as it relates to sustainability, our roles really follow into 2 strands, right? We have the workforce economic development strand, which is, both on the career education side, and it's on the traditional transfer to a 4-year university pathway, right? And so we prepare students for career opportunities to really pursue careers within that space, that sustainability space. And we have programs that essentially run the gamut of anything that can be considered quote unquote sustainable, right? If there's a job out there or a career opportunity, very high probability that we have a program that leads students for that. And the other strand is really, I think, the strand of developing what I like to call global and responsible citizens, right? And that strand is, I think, equally as important as the economic development, the career pathway strand, because we're essentially preparing these students with, equipping them with information and knowledge that they're going to need to be responsible leaders moving forward. Not only do we have the responsibility to prepare them to get out and work, we have the responsibility to prepare them to be better stewards of the environment. A lot of our underserved communities, as Dr. Mario mentioned, just don't necessarily have the same level of access and even the same understanding of some of these issues. And when our students come to us, it's our responsibility to essentially equip them with the knowledge necessary to be responsible so they can push on our civic leaders, so they can be involved and engaged at the local, state, and national level to really advocate for improvements, that are going to help us all to improve, our natural environment and our built environments as well.
Great, thank you so much. And actually, Dr. Powell, I think I'd like to stay with you if you don't mind, because we've come to you virtually because we are still in the midst of a pandemic. I think the last time the Congressional Black Caucus Convention was together, we were all together in DC in 2019 or 2018, maybe. I can't remember. It's been a while since we've been together, and we're in a pandemic. Dr. Powell, very specifically from your perspective, how has the pandemic impacted the education sector and your ability to prepare students for success in sustainable careers?
Yeah, thank you for that, Larry. That's a really good question. And it's a very, I think, multi-layered and dynamic, response that I have to that, right? Because I'd say that the pandemic has had, a very profound effect on the delivery of services, on how we as institutions really prepare ourselves to serve our students, and how we, really as institutions improve upon really the access issues that a lot of our students have. So I'll say that the initial response was like, oh my God, what are we going to do, right? March of last year came, and our district was one of the really first districts in the state to be as aggressive in restricting, student access to on-ground courses and shutting down in preparation for what we knew was going to be a prolonged, closure, essentially, until we got things more under control. And I'll say that as an institution, I don't think we were as prepared as we could have been, right? And a lot of that, I think, has to do with just change within our system in the education sphere and sectors. We don't necessarily handle change as rapidly or quickly as some other sectors or industries, right? And so our modality of delivery has been fairly consistent. You come on campus, you're physically in the campus, you're interacting with your classmates and your professor. But we were not early adopters of new wave technologies such as Zoom or other elements that would make virtual and distance learning something that we could do very quickly. And that's something that we had to build competency in very quickly. And I think the other thing that complicated that is, again, going back to just our student population and the demographics of the students that we serve. Unlike some other institutions, most specifically, let's say the CSU or the UC, our students are coming from such a broad background, right? We have students who are high school graduates coming straight out of high school, all the way to mothers, grandfathers returning back to school, current people who are employed in the workforce who are looking to augment their schedule with additional classes. And so we had to find ways to serve all of these students in a remote-based environment, and then do it very effectively and well, right? And that really necessitated for our most vulnerable student populations that we do things like develop programs where we can distribute computers for students that don't have access to reliable computers, broadband internet. We partnered with Comcast and AT&T locally to ensure that our students had access to broadband internet. Again, going back to Leonard's comment about equity, right? Like not every response or thing that we do for a different population is going to be the same. And so we had to really, I think, in a very short period of time, gear up and prepare to serve our most vulnerable student populations in an effective way. That also necessitated that we as a system learn how to become better at teaching remotely, right? And so we developed seminars and working with diverse student populations and the things they would encounter in a virtual space. Again, all things that we needed to do in a very short period of time to prepare to deliver a high quality of instructional program in a short period of time.
Gotcha. And just as a quick summary, have you felt that you've been effective? Have you been able to kind of reach, particularly, as you mentioned, the community college district tends to be more reflective of the entire population. Have you been able to be successful in some of those outreach efforts?
Absolutely, I'd say so. I'd say that it's also preparing us to do things that we probably should have been doing anyway. Without taking too much time, there's just one quick thing I want to say that our evening population of working professionals was a declining population. And that was because we weren't providing enough sections at night for students that had full-time jobs. Shifting and moving to the online platform has opened up a lot of opportunities for students who otherwise would not have been able to find courses because they have other responsibilities throughout the day. So that's one example of ways that we're improving what we've been doing.
Makes sense. So Louis, I'd like to come to you as well too. You not only are well-versed in a lot of areas in economic development, but you also transitioned during this period as well too, professionally. But so how has the pandemic impacted your ability to create sustainable partnerships over the last several months? And how as a viewer, how can viewers help with those types of efforts?
Yeah, no, absolutely. I appreciate the question. It's been a challenge onboarding to a completely new role virtually. I've literally only met 3 people at the company in person. Everybody else has been virtual, and my role is contingent on me getting to know people, just like it was when I was with the state and with the city. And back then, go out, travel around the country, shake hands, see people face to face, and get to know people. This has all been via Zoom and Teams, getting to know the HBCUs and trying to get their attention, getting to know HSIs, even with trying to work with community colleges, and coming in with an offering from a company that hasn't traditionally reached out to those communities. There's been a lot of hesitance to respond to incessant emails on my part, and I never thought that I'd be the emailing type. So it's been really interesting. But ostensibly, my role right now is to offer new pathways for Black and Brown communities into artificial intelligence, whether that be in the healthcare space, whether that be in the climate space, whether that be just traditional engineering and hands-on robotics. And so anybody watching that has connections to HBCUs, HSIs, whatever, and wants to develop some kind of true partnership, the easiest way to find me is just to hit me up on LinkedIn and Twitter these days. I think I've been more active there, just and gaining partnerships with people and gaining credibility with the audiences that I'm trying to reach, in order to talk about how do we train up historically marginalized communities so that they're ready for the next wave of artificial intelligence and the 4th industrial revolution. And I think that I'm hoping that things open up in the next year or so. I'm able to get out and actually meet people, and so that you can truly look people in the eyes and they get to feel the sincerity in which companies like the one I work for now with NVIDIA are trying to change the game, trying to make things more equitable, and trying to create new pathways for people to get into technology.
So if I can stay with you for a quick second, Louis, I've known you a long time. You've been in both public and private sector spaces, and have been a true ally and champion in these areas. As we talk about, the intersection of private public partnerships and where these sustainable efforts are being proposed, how are we getting more voices like yours and others at the table to really make sure and champion and maybe the question is not to try and get more voices in, but to try and change the systems themselves, so the conversation is coming from a lens of equity more consistently. And I know, look, you're one person. We only have so much time, but I'm curious from your perspective about addressing that.
Yeah. So I mean, look, the biggest thing is and I'm sure everybody will say this is to be intentional with the efforts, right? You have to actually go out and get the people that you want, and that you're supposed to be serving, so that they're in the rooms when the decisions are being made, right? And so that's actually why I give a lot of credit to NVIDIA. They came and got me in the middle of all the social upheaval that was happening after George Floyd's killing, and they said, "We need you in this company. We like your voice. Come help us reach out to these communities." And if you look now with what's happening in the U.S., diverse voices are needed more than ever, and a lot of the programs that are being discussed nationally have that equity lens built in, and so now it's the job of all of us to actually make that happen. Volunteer for stuff, raise your hand and get involved, but then be unapologetic about voicing your opinion and being heard. If something doesn't ring quite true, make sure that you are fact-based and you come with the viewpoint that you personally have, because you're right, I'm only one person, I can't speak for everybody else. I am learning about mental health because of family. I'm learning about some of these other things that have come to light because of the pandemic, and being more knowledgeable about those areas actually helped me, navigate the virtual world, virtual relationships, and make sure that I stay at the top of my game. But more than anything, we have to be intentional about going to get the people that we're trying to impact and have them in the room making those decisions. And so it's been, just personally for me with the HBCUs, it's taken 10 months, but now they're actually responding to emails. And it's awesome because now I'm finding out exactly what greatness they're doing with AI, what greatness they're doing with cybersecurity. And now I'm turning my head a little bit to the community colleges and trying to understand how we can impact those relationships. So, if you're not intentional about going into the community and listening, and then going to grab the people that you need to make the change, there's not too much that you can do.
Gotcha. So starts with the intentional effort, and then we'll work on policies and procedures and all that other stuff once we get the folks in the room to speak up. I've always said, particularly when we have underrepresented folks into places and spaces where they haven't been, being silenced or not speaking up is a double dilemma for our community. You're in the room for a reason. And we need to make sure that we speak up and represent for these communities. So it's been a long time since I've heard from my Enviro bro, Leonard Robinson. And Leonard, I know that you, like you said, you've been working in this space for, I don't want to say generations, but at least decades. Yeah. But seriously, but you have been. And so you've seen a lot of different things. From your view, what are some of the solutions for achieving sustainability in underrepresented communities?
Okay, it comes from three folds. And first, I'm glad we're starting to use underrepresented communities, because before we used to say disadvantaged, like we're some big cosmic mistake or something. So underrepresented, underserved, perfect terms, because that's what COVID brought out. It acted as a fuse link to find out who's getting what and what's getting what. But there's three ways to address sustainability in underrepresented communities. First is policy. You have to have good policy. And good policy doesn't come as a silver bullet. That only works on werewolves. You need that shotgun blast of different solutions at different times. So you have to have good policy. And we need to help our politicians make good policy by telling them what the needs are and what are the best strategic advantages. The next thing is education. Education's important. Now, everybody wants their child to go to college and get a undergrad and postgrad degree. Well, not every child is cut out for college. Not anything bad, but some kids are better entrepreneurs. Some are better with their hands. So there's in the green economy, there's all kind of great jobs like installing solar panels and fabricating, these vents for fans and everything. So there's all kinds of opportunities. So what we have to do with education is not only educate, but put our children in the best environment to succeed. And then the last thing, because I'm going to really do something different, be brief. The last thing is activism. We have to get involved. You can tell you're effective in activism when they try to take things away from you, like voting. So we have to get active. You talked about being at the table. If you're not at the table, you're going to be on the menu. And so we have to get the table. And if they don't let you at the table, you bring your own table to it, and you make a loud noise. So we need activism. We need people. We need to protest, but voting is activism. Running for office, and then again, sending those letters to editors and supporting groups like the Sacramento Observer and the Sacramento Black Chamber of Commerce, supporting those type of groups in their efforts to get the message out, and encouraging good people to run for office. See, good things happen, bad things happen when good people do nothing. Doing nothing is just being part of the problem. So three things again, we have to have good policy, we have to have education, and we have to have activism. And I think we can achieve it we can work on the sustainability in the underrepresented communities, because we need to give them, they need to have a place at the table, whether they're invited or they take that place at the table.
Gotcha. Leonard, you said you're going to be brief, and I don't like it when you're brief because you drop so many gems. Let me just ask you, if you can, where have you seen it? Where have you seen it done well? Where have you seen the effort of equity and inclusion, along with sustainability efforts, done well? Whether it was in the private sector, public sector, even if it was just at one particular business or corporation. I mean, what have you seen it done well?
Yeah, I've seen the potential. I've seen the vision, and I can see the potential of what can happen. See, I've worked in the public sector, I worked in the private section, I worked in the nonprofit, and now as a sustainability strategist for the Archdiocese of Atlanta, I'm in the faith-based segment. And it's, I think what it's going to do, it's going to take all three, not just 1 out of 4. It's going to take everybody working together in their roles, making it where it's working so close together that it's seamless. Yeah, I have seen it. I came in the administration of the California Environmental Protection Agency, and good, bad, or indifferent, at least we tried different things. And if it didn't work, we admitted, hey, it didn't work. We need to try something better. We took words like environmental justice from a punchline to part of it. Now, what we need to do is weave sustainability in everything that we do. But I've seen it in various sectors. I've seen it in cities and everything. But what I'd like to see is just all four perspectives working together in one spot. And I think what we're doing here is the beginning.
Great. I appreciate it, Leonard. Dr. Mario, you gave us a lot at the beginning, and I want to dive a little deeper with you. As again, we're in the midst of a pandemic, and healthcare, like you said, if we don't have our health, we really have nothing else. And I really would like to get it from your view. So, like Dr. Powell had mentioned, the education field had to kind of do a little bit of a pivot here during COVID. Obviously, the healthcare industry was greatly impacted here during COVID. So how have health plans been leveraging technology and really to address, you mentioned, I think, a term that is so critically important, the social determinants of people's lifestyles, right? Technology, we had this gap where we saw when COVID hit, where people didn't have access. If you didn't have technology, you had no access to healthcare, you didn't have access to shopping, you didn't have access to, lots of different things. And so it really put communities at risk. How have health plans like Molina's and others really leveraged technology to support those communities and built in equity within their sustainability efforts?
I think it's a great question. And you're right, the concept of social determinants really does cut across a lot of areas. So we can talk about food insecurity, we can talk about employment or economic instability. We talked a little bit about safety in your own neighborhood and community. The concept of social isolation maybe even in a community that normally had that, but because of COVID-19, now all of a sudden it doesn't. So you have elderly folks that are all alone. And one of the most interesting things from the behavioral health lens is that although communities of color are less likely to have or suffer from acute episodes of things like major depressive disorder, the prevalence is actually a lot higher from the standpoint of the chronic ongoing effects in someone's life and impact on their ability to kind of move forward. So it has a much larger reach and area. I'd say maybe the star of the show for us was telemedicine. And I don't mean just phone, I mean video as well. Although an interesting thing that we saw is that, as you all know and can probably imagine very easily, is to say, well, not everyone has access to broadband. And that's one of the most interesting things that we saw, is that for those that don't have access to broadband, the audio became so important. It became a lifeline. And right now we're in a situation where a lot of states are, because of the public health emergency, they're clawing back all of these flexibilities that were allowed during the pandemic. So we're no longer offering in many states the ability to have doctors and nurses engage with folks in their own home, say through telemedicine. Just to give you a sense of in a year-over-year comparison, we had about 700,000 claims from in a 12-month period for telemedicine related things before the pandemic. Through the pandemic, now 4.2 million. That's the magnitude of change. Top diagnoses, the top 3 among the top 10 were major depressive disorder, generalized anxiety disorder, and addiction, or opioid use disorder in particular. Okay, now, like I told you before, Molina was started off in particular to look at and serve vulnerable populations. In fact, 90% of all of our patients are Medicaid. We specialize in the most vulnerable populations. And I'll throw that term in there. We talked about underrepresented. Okay, now I'm going to say also there is the concept of a vulnerable population, because one of the things that we also had to do is leverage our information systems to be able to have some sort of a vulnerability index that we can now kind of data mine with the information we do have to know ahead of time when a particular group is in trouble in a particular geography, because we're scattered around, 17, 18 states. And so they're not, someone in Ohio is not the same as somebody in California and so on and so forth. So what telemedicine did for us is it allowed us to reach across rural populations. It allowed us to be very creative around follow-up appointments to keep people engaged if they were hospitalized, and when they go out, that there's still the connection. And so I think that really for us has been the star of the show. From the standpoint of substance use, you also have to think that among the Medicaid population, there's also a good group of folks that are leaving the incarcerated populations, what we would call the reentry folks, right? And the reentry folks have a lot of needs that fit specifically with what we're discussing. They need economic stability as well when they get out. So one of the things that we did is we started coupling things like employment, coalitions with community-based organizations that already have in their community those things worked out. As we begin to engage them in some of the services they might need, particularly around substance use, for example, when you get out of an incarcerated environment and you are on, say, medication-assisted treatment for opioid use disorder, the rate of overdose that happens in the first couple of weeks goes up astronomically. Like the likelihood of you living is a big deal. So these are some of the things that we get from leveraging technologies that we had to pivot immediately. And we, Mr. Powell here has already talked to us a bit about kind of that idea of the means of how you communicate. Well, that also has all to do with health equity, because for us, if we don't also invest in health literacy, and that doesn't mean do you know how to read? It doesn't necessarily even mean can you understand the language. It actually means that you understand the concept of the global part of your health and how it fits in your community, and what services you have. And that was another area that we've needed to invest in to be able to ensure some of that health.
And let me just ask you. So I mean, you mentioned the huge jump in the community that you're serving. And the needs are so great. Have you seen the successes? Have you seen the outcomes change a little bit? I know we're so inundated with COVID numbers and those types of things, but have you seen an impact where you're kind of merging this space of future health plans and efforts with those that have been underrepresented and vulnerable?
I think so. I think that the main lesson for us is that the idea of success isn't always found in a metric that healthcare traditionally tries to measure. And the idea of success needs to be in the context of one's environment, one's family, one's community. So we definitely are seeing some improvements from that side, and we measure that primarily on engagement. So how engaged somebody is. So for example, in some groups, we've had to give cell phones out. For example, in a group of somebody that is in a perinatal period of their life where they're pregnant, they have a substance use issue, And we need to make sure to engage them at the highest level to improve neonatal outcomes so that when that baby's born, that the baby has the best chance of being healthy and that she's supported. Because one of the things that also that we need to understand that technology helped with, and because of COVID, is that when it comes to mental health and substance use, particularly in communities of color, stigma is what kills the most. So now it wasn't that Miss Jones had to go to a place that says blah, blah, blah recovery. She can actually engage from the comfort of her own home with the support system she has at home to be able to engage in some of the information around prenatal care or whatever it might be without the stigma of being worried about being judged, particularly in that group. I mean, that's maybe the most marginalized of all, that the pregnant mom who has a substance use issue, because so many people have so many judgments around that. But what she needs is support, not judgment. So that's another thing that's helped us. So we measure that in engagement. And so I think that there will be much more to come. I believe we will see changes in outcomes. Sometimes those take years to see, though, particularly around things like infant mortality. And so we will continue to need to study that and need to continue our civic engagement to make our leaders know that we need to keep the flexibility, not curb them back.
Gotcha. So we're getting close on our closing time. I'd like to really just give an opportunity to maybe ask each panelist very briefly, what we didn't discuss. What do we want to make sure that our viewers take away with them related to this area of equity and inclusion from each area? And so what I'll do is I'll go back to Dr. Powell. I'll start with you and just briefly kind of tell us what you want to make sure that our audience doesn't forget related to this effort.
Thank you for that question. I'd say, first and foremost, I just really want to reiterate, the role, the purpose, the power of the education sector, at any scale, whether that be the community college clear up to the university level. Really our role in ensuring both equitable outcomes for our most vulnerable populations, our most disenfranchised, whatever term we're going to use, right? Making sure that our people within our local communities have access to opportunities to improve their lives and to improve their communities. The education sphere and sector, most specifically the community college system, that really is our role, right? And to do that, we really need the support, of our local communities. We need the partnerships with our industry. We need collaborations with nonprofit sector, with the medical field, the medical professions. We need partnership and engagement with our local civic leaders, with our policymakers, because our students, most specifically at the community college level, are very much representative of, our diverse changing demographics of California, right? And our role essentially as the education sphere and sector is to ensure that they do have opportunities to, go out and improve their lives and also to just improve the world. I'd say that the other thing I want to reiterate, which is something Leonard brought up, is he mentioned the need to weave sustainability into everything. I would go a little further and say that when we're talking about economic development in the economy, there is really no green economy. There's just the economy, right? Because the changing demographics with respect to what, especially in California, we emphasize as really economic development are focused on innovation, that innovation sphere and sector. And so as the education sector, it really is our role to ensure that we're creating those opportunities for students to prosper in that economy, and then also to just improve the outcomes in our community. We are very much committed to do that, and it's something we take a lot of pride and passion in doing.
Great. Dr. Mario, what do you want to make sure that our audience doesn't forget?
I would say that maybe the most important thing is that when you think of healthcare, and I think that I would hold out and throw the call to action to all of my colleagues, both from the smallest of clinics to the largest of health plans, is to really consider that movement towards equity around those social determinants of health and to invest in it. we're past the days of being reductionistic, that we really do need to look at health and from the context of all of our environment, of our literacy around that. And so that's the call to action, really. And we should be holding all of ourselves accountable to that investment, particularly among those healthcare, which is such a large part of our economy, such a large part of our lives. So let's keep everyone accountable around those social determinants.
Great, thank you so much, Louis. I'll go beauty before age, Leonard. Louis, how about you?
No, thanks, Larry. Look, what you heard from the panelists today is that everything is connected, right? It's going to take government, it's going to take academia, it's going to take industry. And all three of those sectors have to be super intentional about how sustainable they're making the world, but also how much equity is built into those systems. And there's from the private sector side, there's a whole lot of companies right now that are speaking equity. Now it's time to actually have people make them do equity. And it can't be just in dollars and cents. It actually has to be programmatic. It actually has to be relational. And there's a lot of folks out there that the viewers can reach out to and actually help make a change. And from our side of the house, everything from bias being built into technology to just flat out digital literacy, period. Helping people understand what the technology means that's about to hit them in the next 5, 10, 20 years. And you have to be part of that change and part of those efforts to make sure you bring people to the table.
Yeah, we could do an entire panel on equity and technology for several panels, I guess, really in that regard. So keep up the good work. Leonard, last but not least, I'll give the final word to you before we hand it back over to AZIZZA. What do you want to make sure our audience makes sure that they don't forget related to these efforts?
Well, a couple of things. We talk about sustainability, but we have to talk about the why. Why is it important? Well, there's health, there's economic development, there's jobs. It's a whole bunch of things that are tied up into it. And a society can't go forward unless the underserved are brought right along. Otherwise, it just becomes a drag. And then we have to communicate the idea of sustainability. See, sustainability is not about hugging trees. It's embracing opportunities for social improvement and things like that. Don't mean to be standing on a box, but I really feel that's what it is. We have to communicate things better. We communicate climate change. You can't put a polar bear in the ice float and take it and take that picture to an underrepresented community and say, okay, this is why we have to do it. No, we have to get to the heart of it, saying, hey, you've got disease, you've got health effects, you've got respiratory things because of the so-called success that we have to address those type of things. So again, there's an expression that goes, things will change when the pain of staying the same is greater than the pain of changing. And my question, everybody, is it painful enough for you?
Well, with that said, AZIZZA, I don't think we could have teed that up any better for you. Again, I'm Larry Lee, a publisher of the Sacramento Observer. It's been my pleasure to participate in this panel discussion. And thank you, AZIZZA, for inviting me. And I look forward to continuing to work with the Chamber as we move forward. Over to you.
Thank you so much, Larry. This was such a rich and robust discussion this morning. I am so thrilled to have you all back. Those of you that have joined us for the first time, we hope that this will not be your last. And for those of you that have been hanging out with us for many of the years that we've been doing this, we are eternally grateful for your knowledge and for your support and for all of the information that you're bringing to our communities at large. Again, I want to thank our sponsors, because had they not been as supportive as they have been, none of us would be sitting here today. So thank you so much, SMUD. And thank you so much, Southern California Edison. We just couldn't do this without you. And your support also shows us just how much you believe in the work that we're doing. This partnership is not going to get any worse. It will only get better as time goes on. And hopefully next year we'll be back together in person in Washington, D.C. But for those that watch this program, we hope that we're bringing you information that will help you in your work and what you're doing wherever you are in this country or in the world. The one thing about doing this virtually is that everybody has an opportunity to look at it. So thank you again, Congressional Black Caucus Foundation, for allowing us this opportunity to speak to our communities, and know that we are really, really happy to be here again. And Larry, I can't thank you enough for the moderating. I also want to give a shout out to our board chair, the Sacramento Black Chamber of Commerce's board chair, Lori Clark, who was very instrumental in helping us pull this together. She's just a godsend to all of us. Thank you, Lori. We appreciate you. And thanks again for everybody that's been joining, and we hope that you've enjoyed this presentation.